welcome back. This is Kirti, clinical psychologist, certified ABA therapist, HOD of psychology at Daffodils CDC, Hyderabad. Today, let us explore a new topic, that is, some children with autism has a problematic behavior that is called head banging. So let us see today what could be the reasons behind that head banging and what could be little remedies or evidence-based strategies which we use in ABA. So first let us understand why the head banging happens. See, predominantly there would be two reasons for this. One is a sensory regulation, other is a communication. What is sensory regulation? Sensory regulation could be the child would be doing this head banging in order to experience some sensory. What will happen is when the child would be doing this head banging against a specific object or against a specific surface, they get a kind of a sensory input. A specific sensory input which would be a self-soothing to themselves. And what is the second reason? Communication. See, children with autism, they face difficulties with the verbal communication. In order to express their pain, discomfort, frustration, they go through this head banging mode. So we came to know what could be the reasons behind this head banging. But before we go to the strategies, one more important segment you should know is we have to maintain the safety. The safety is very important because when the head banging happens, we should be very careful with any kind of a physical injury. That could be a cut, bruises, could be anything which we need to be very careful enough. And second thing is, we usually suggest to go and seek a medical professional first. That means, is this head banging being caused by any other medical conditions that has to be ruled out in any of the child, especially the autistic child. And the third reason what we say or what we suggest is, please first, before we implement any strategies, first consult an ABA professional and get a functional assessment done. So this gives us the function of that behavior, function of that head banging behavior. So when we know the function, means what could be the reason, what could be the trigger point of that, then implementing this evidence-based strategy will be really helpful and will help us to reduce that head banging. Now let's see what are the ABA strategies which we can use for a remediation. So first strategy or modification which we do is replacement behaviors. First, we need to identify what is an alternate and socially appropriate behavior for this head banging. Very much important. So, the socially appropriate behavior should be identified. And what can that be? That could be a sign language, that could be a gesture, anything which can be used as a head banging, which we have to teach a child for a head banging. So for example, in a specific environment or a specific activities, child starts sudden head banging. What we can do is we can use a sign language or we can teach them a gesture, something where instead of head banging, they communicate with us using that socially appropriate behavior. And the second thing which I would suggest is environmental modifications. What happens is some kids, when there is overly sensory stimulation around them, could be very, very bright lights or could be very dark colors surrounding in the room, could be the curtains or could be anything which is triggering their sensory input. So what we can do, we can modify those environments. Again, if we trigger and find out the patterns, we can easily understand what could be the environment things that is causing their head banging. So modifying those factors in the environment will really help the child reduce the head banging. And the third important, which I always say and use it in everything, reinforcement. See, when the child themselves, instead of head banging, go and use an alternate appropriate behavior, as a parents, we should immediately reward them. Rewarding could be a simple praise, a big hug, a good high five, or a good social praise, good job, anything. Using a reinforcement appropriately when a child is not doing the head banging will make them understand that yes, if I'm not doing it, I'm getting reinforced or rewarded. And the next major important technique is functional communication training, FCT what we call. See, instead of head banging, if we teach child an alternate communication skill, that could be simple help or simple break. Usually kids for communication itself, they do head banging because they might not liking to do that activity. They are unable to express it verbally that I don't want this now, I want to stop it, I'll do later, could be anything. With that frustration, they just immediately do head banging. So what we can teach, a simple break card or simple help card first, a picture exchange card, or if they are little verbal enough, just words, break or help. If we teach them this alternate communication, so what they will do, instead of slowly doing that head banging, they will come to this break or help, and which is a very powerful technique which we have to do in a very consistent manner. This will really give a result of that reduction in the head banging. So these are a major 4 techniques which we suggest when a child is doing this problematic behavior of head banging. But please do remember, when we do all these things, first important thing you should put in your mind is please collaborate with the ABA professional who can first identify what is the function of this head banging and then suggest the appropriate evidence-based strategy for that, and they give an individualized plan on how to reduce this head banging. Today we have seen a problematic behavior, that is head banging in autism children, and how we can reduce it. Still there are more problematic behaviors like hitting, pinching, biting, throwing objects, crying, screaming, rolling on the floor. So if you want to know more about any of these problematic behaviors, please put down in the comment section. And still, if you want to know more about any child's development and psychology, please feel free to contact us at Daffodils CDC. Thank you.